How does airway resistance affect your breathing mechanics? Imagine trying to breathe through a straw that keeps narrowing. It gets harder to draw air in or push it out. That's similar to what happens when airway resistance changes in your lungs. Airway resistance is the opposition to airflow inside your respiratory passages. It depends mainly on how wide or narrow your airways are and how flexible their walls are. When you breathe, air moves from the outside environment into your lungs during inhalation and back out during exhalation. This movement is driven by pressure differences caused by changes in lung volume. If airway resistance goes up, your body needs to generate more pressure to keep airflow steady. That means your breathing muscles have to work harder. For example, if your airways become narrow because of inflammation or muscle tightening, it becomes more difficult to breathe. You might notice feeling short of breath or needing to breathe faster. On the other hand, if resistance drops, airflow becomes easier and breathing requires less effort. This can happen when your airways are wide open, like during relaxed breathing. The size of your airways plays a big role here. According to principles similar to Poiseuille's law, resistance is inversely proportional to the fourth power of the airway radius. So, even a small decrease in airway diameter causes a big increase in resistance. Conditions like asthma or chronic bronchitis cause your airways to narrow. This makes breathing more difficult because the airflow is restricted. During these times, your lungs have to work harder to get enough air in and out. The size of the airways also changes depending on whether airflow is smooth or turbulent. Smooth, or laminar, airflow faces less resistance, while turbulent airflow, which happens in larger airways or at high flow rates, increases resistance. Your respiratory system's anatomy influences resistance too. The nose and upper airways contribute a lot to total resistance during nasal breathing. The lower airways, including the bronchi and bronchioles, have muscles that can contract or relax to change their diameter. This helps regulate airflow during different activities. When you breathe in, your lungs expand and pull on the airways, helping to keep them open and reduce resistance. During exhalation, especially when breathing out forcefully, the airways can narrow, increasing resistance. The balance of forces involves lung elasticity trying to collapse the airways and the outward pull of the chest while keeping them open. In summary, when airway resistance increases, your respiratory muscles need to work harder to maintain airflow. This can make breathing feel labored or uncomfortable. Understanding how resistance works helps explain how your body maintains proper ventilation and how diseases that narrow airways impact breathing. It also guides medical treatments aimed at opening airways and making breathing easier.